15 years ago, I could never have imagined that I would be discussing this on a public platform. But then I thought, if not now, then when? We are in 2021, and yet women's health is not a priority. In most Indian households, still discussing menstruation and pregnancy is considered a taboo. And you, my friends, can understand now that how tricky discussing hormonal imbalances, irregular cycles and infertility can be. A study says that one in five women in India suffer from PCOS. If not monitored in time, the condition can have serious and really bad health impacts. And in order to throw some light, we have with us Dr. Ananya Bora, and she is an assistant professor in SET-GS Medical College and KM Hospital. She has mastered in I don't know how to say it, Ananya, you have to say it yourself.
Obstetrics and gynecology.
Yes. And she has worked as a senior resident in Sion Hospital as well. She has been a wonderful student throughout and a keen advocate of women's health. So we welcome you, Ananya, and I would like you to tell something about yourself, and then we can start with the session. Over to you, Ananya.
Thank you so much, Smritika. That was very kind of you. So I have been in love with biology since it became a subject for me in class 12. I have somehow always understood it better and related more to it, knowing the anatomy and how the body functions. And once I was done with my boards, I knew this is where I want to go. I knew I wanted to be a doctor. So I come from a medical background. So I have seen my parents talk about it, deal with it since long. So somehow there was a direction since the beginning, but also I love the subject a lot. After my MBBS, I first had a liking for surgery in the beginning, general surgery. But with internship, it became very clear that obstetrics and gynecology is my love. That is something I can very well understand, and something that really gave me joy working in OBGY. We say OBGY short for obstetrics and gynecology. So yeah, that's when I did my post-graduation also from KEM Hospital. And after that, I worked for a year and a half in Sion Hospital. One year as a bonded candidate, after that another 6 months in COVID times, and after that now I'm back to my alma mater, KEM, as an assistant professor. So that's it about me.
How has been the experience during the time of COVID? I want to know that, and how it has affected women's health in general.
It actually has affected women's health in both ways. If you see in obstetrics, what happened at that time was because of the fear of COVID, the fear of coming to hospitals, people stopped coming with, for the regular ANC follow-ups. This is what I'm telling about the pregnant women who used to come to us. So they started coming less frequently. So a few things got missed in that process. They used to only come when it was an emergency. But otherwise, and as we're talking about PCOS in general health, what happened with the lockdown was there was a lot of stress. There was a lot of, sitting at home and eating junk. There was a lot of watching TV late in the night, because of which there was decreased sleep. All this has increased more chances of, hormonal imbalance. This has led to a lot more weight gain and some difficulty in the menstrual regulation of a normal woman. So this has been seen. This is more common, has come out as a more common thing post-lockdown now.
Yeah, I can truly relate to it, because that is when, this is the only time when I discovered that there has been an irregularity in my cycle as well. And it happened in the month of February, if I'm not wrong. And usually ever since my menstruation had started, my cycles have been quite regular, because I was never overweight. And I think precisely that is the reason. But since I had thyroid issues, and it has been there for almost 7 years or so, I had this feeling that, this condition could occur, because there is if there is an imbalance in your thyroid levels, it may lead to some kind of other hormonal imbalances as well, right? So in the month of February, I remember my period was extended, and obviously I was really, really worried. And then I thought that, this is definitely not pregnancy, because I was not feeling pregnant. And when I took the test, it was negative, and then I had to go see the doctor. And I somehow knew that, this is PCOS. And then the doctor told me that this is hormonal imbalance, and maybe you'll have to take some medication or something. I said, no, I will not take medication in the first place.
Yeah.
I spoke to Zanita,
Yeah.
and I decided that no, this is it. Now I'll take care of myself. I'll prioritize my health, because that is what I said, that women's health is not being prioritized.
Yes. Yes.
I decided that, and yeah, I'm doing well. I'm in a better state, so that about it. Okay, so we should start with the session, Ananya. We have about 84 candidates online.
Okay.
So,
can I start sharing my screen?
Just a moment, ma'am. Just.
Yeah. So,
Yes, ma'am.
before so I can share now?
Yes, ma'am.
Okay, just a minute. And okay, yeah. So, so sorry, yeah. So as Smritika already said, like she has started for us, why is knowing PCOS or polycystic ovarian syndrome so important now? It has actually become a household term. You can hear people say, yeah, I have PCOS. Do you know this person has PCOS? So it has actually become so common. People talk about PCOS all the time. But more than that, we need to know what are the signs? When do we need to know, okay, this could be leading to PCOS. This might be something that is, that might end up in PCOS, and I need to work on it right now. So my attempt today will be to help you all know PCOS better, to understand it better, and tell you something about how to cope with it. It'll be a small attempt. I hope it helps everyone. So why is it so important for us to know? So like Smritika already said, that it's seen in 1 in 5 women in India now. So around the world, around 8 to 10% of women have PCOS. The incidence is increasing so fast because of the changing lifestyle. And in Asia, in India, the incidence is around 30%. We have a higher predilection for conditions like diabetes and intolerance to sugar. So that's why the incidence of PCOS is really high in Asia. So before knowing, we need to know what exactly is PCOS. What exactly is PCOS? So it can be described as a condition that affects the entire body, though it starts in the ovary, though it's called polycystic ovarian syndrome. It is something that has implications over the general health. It does not stay confined just to the ovaries. It can affect women of all ages. It can have, so sorry about that. It can affect women of all age groups. It could be adolescents, reproductive age group women. It could be postmenopausal women. It could be the most common hormonal disorder in women of the reproductive age group. And also it is one of the leading causes of infertility nowadays that is seen. So that's why it's important. Usually people come with complaints of infertility when it's already too late. Maybe during their adolescence, they had symptoms which could have led to the diagnosis of PCOS, but then they come pretty late when it's already, they're having symptoms of infertility. So it's very important for us that we diagnose PCOS as soon as we can. And it has also many long-term metabolic consequences, like it could lead to lifelong diabetes, hypertension, endometrial cancers, and all that. So, just a minute. Next slide. Yeah. So let's talk a little about the history. Not that it helps with the diagnosis or anything, but just because it's very interesting to know how people started to understand like how it was diagnosed. So polycystic ovaries were recognized as early as the 18th century. But at that time, it was only associated with pelvic pain or menorrhagia. Menorrhagia is increased bleeding during menses. So then again, in the 20th centuries, many theories started circulating, thinking that it could be infection, inflammation, congestion, or ovarian nutrition, which is the cause for PCOS. Finally, in 1935, Irving Stein and Michael Leventhal, they first described the symptom complex, and they said it was associated with anovulation. Anovulation is basically no ovulation. So we'll come to the pathophysiology and what exactly happens in it later. So this is just in short about the history. So now we need to know why it happens in the first place. What causes PCOS? It actually has no answer. So the exact cause of PCOS is still unknown, but it has been considered to be a multifactorial condition. There's a strong genetic and environmental factor which both contribute to it, but there's no specific gene, not a single gene or a family of gene that has been identified to cause or contribute to PCOS. But it can be either a maternal origin or a paternal origin, or it can be from both. And environmental factors which are associated with PCOS are usually obesity and stress. It could be the bad lifestyle habits of eating junk, sleeping late. So all this do contribute to PCOS because it in a way disrupts your hormonal balance. So all in all, genetic predisposition with a favorable environment leads to PCOS. Favorable environment, not favorable to the person as such, favorable to the disease condition.
The candidate or what?
So
I don't know.
So there is a age-old question of
80?
89.
Sorry. Okay, so there is an age-old question of what is PCOD and what is PCOS? Is it the same thing? Are they two different things? Is there some different set of characteristics of both? Is the modality of treatment different? But so no. So PCOD and PCOS is actually one and the same thing. To be very specific, a disease is a characteristic set of signs and symptoms, whereas a syndrome is a symptom complex that consists of a variety of signs and symptoms. So over the time, PCOD, which is polycystic ovarian disease, has been evolving into a PCOS, which is polycystic ovarian syndrome. As it has a wide spectrum of symptoms, it is the term PCOS is more preferred. So before we go into the what happens, why does it happen, we need to know what normally happens. What is the normal ovarian function? What actually happens in the ovary? So this, if there are students from class 12, they will find this diagram this picture very familiar. This has been taken from the NCERT book of class 12 because I could not find a better picture which explains it in a better way. So this, as you can see, it shows, this shows, there are 4 diagrams. The first one shows the pituitary gonadotropic hormones. Many of you must be already aware of the endocrine system. So pituitary is one of the organs which secrete hormones. And the next one shows eggs in the egg follicle development in the ovary. The third picture is the ovarian hormone levels. These are the ovarian hormone levels. And the last one is the endometrial lining of the uterus. This is the uterine cycle of the uterine cycle of menstruation. It shows how there is menstruation, there is a proliferative phase, there is proliferation of the endometrium, then there is a secretory phase in which it's maintained, there is nutrition, and later again it comes back to menses. So the hormonal control in this, what we are today focusing on is ovulation, right? So ovulation, with the ovulation you can see a dotted line here. So it corresponds to these 2 hormones. Okay, there is follicle stimulating hormone or FSH, and there is LH, which is luteinizing hormone. So these are the 2 hormones which have control, and they act on the ovary and make these changes happen, makes the ovary secrete these hormones. So what is so required for ovulation to occur is this peak that you can see here, the peak of LH. It is known as the LH surge. It's not that this is the only thing that works, all the hormones need to act in sync for this to happen, but this is the primary event that leads to ovulation. So this here, as you can see, this is the developing follicle, ovulation occurring here. This is estradiol or estrogen, a form of estrogen as commonly known. This is progesterone. So in the next slide, we can see this is a cross section of the ovary. Okay, so here you can see this is the entire ovary. This is the ovum, that is the egg, which is developing. This is the primary follicle. These are developing follicles. This is a Graafian follicle. I won't go into the details of it, but as you can see, this is where the rupture happens. This is ovulation occurring here. So this is the development of the ovum. Okay, development of the egg till ovulation. So this function is important for a normal menstrual cycle. So now I'll come to the pathophysiology. I'll try to explain it as simply as I can. Pathophysiology means how the mechanism of the disease, basically. So PCOS, the main feature of PCOS is insulin resistance. Insulin resistance means the body does not react to the insulin circulating in the body, because of which even more insulin is secreted. So that causes a constant high level of insulin in the body, which is known as hyperinsulinemia. This high level of insulin in turn results in a persistently high level of LH, as we saw here. So we need just a peak, we need a pulse of LH. Instead of that, because of the high level of insulin, there's a high level of LH constantly. So that in turn causes androgen production from the ovaries. What is androgen? Androgen is the male hormone. It's not that usually it's not there. Every woman has some amount of androgen circulating in the body, but this because of an excess of LH, there is a increased amount of androgen in the body. This androgen is responsible for many signs and symptoms of PCOS. We'll come to that later, the clinical features, how it presents. Also, due to the inactivation of a few specific enzymes, the androgens which is in excess would have been usually converted to estradiol, which instead gets converted to estrone. So to explain it better, let me tell you. So estrogen has three different molecules. There is estrone, there is estradiol, there is estriol. So basically in the reproductive age group and in adults, the estrogen that we need, it is estradiol. So let's consider it as the good estrogen. And estrone is usually the estrogen which is functioning in the postmenopausal age group. So in this condition, what happens? There is an excess of estrogen, but not as estradiol, as estrone. This conversion happens in the adipose tissues. Adipose tissues means fat cells. So there's a high level of estrone. All that high level of androgen will cause the symptoms of, which we'll come to later, what it causes, how it expresses. Apart from that, it gets converted to estrone, which in turn causes a negative feedback. So here, as you can see, estradiol is there. A high level of estrogen keeps the FSH low. So when estradiol is high, your FSH is low. But here, estrone is high. The pituitary does not recognize estradiol or estrone. It knows there is an estrogen which is high, because of which there is low FSH. Low FSH again results in which results in arrest of the developing follicles inside the ovary. So basically, a high level of androgen circulating in the body with this high level of estrone causing a negative feedback on FSH causes the follicles to arrest in growth, and they become cystic because of the degeneration. I hope you guys can follow, because you can just ask me questions in the end if there are any doubts. Here, as you can see, there is this normal ovary. This diagram shows a normal ovary having follicles which are developing. And here, these follicles have been arrested in growth. This is a mature follicle. It doesn't rupture. There is no ovulation happening. And it in turn arrests and degenerates into cysts. So this is the polycystic picture that comes here. So this in turn leads to chronic anovulation. So chronic means over the time, something that has been there. It's a chronic event, and anovulation means no ovulation. So basically no ovulation over a period of time with multiple cysts. So there is a vicious cycle of hyperandrogenism, that is increased level of male hormones, and anovulation, which tends to worsen over time. And what's the role of obesity in PCOS, if you think about it? So basically obesity is increased fat tissue. This increased fat tissue interferes with the insulin signaling pathways in the liver, because of which there is insulin resistance, which causes this entire cycle of events. So basically it's a vicious cycle. One event leads to the other. So controlling it in time is very important, and how we'll discuss. So in adolescence, this is the perfect time to pick it up and start working on it, because this is when it starts presenting first. So what are the symptoms that could be there? So there is menstrual irregularities. So it's not compulsory that everyone with PCOS will have menstrual irregularities. Many people have regular cycles, even with having PCOS. So having less than 6 menses per year or irregular bleeding, around 50 to 70% of people with PCOS have menstrual irregularities. The other thing that is there is obesity. So it's seen in 30 to 70% of the women with PCOS, not with everyone. So do all people with PCOS, do they have obesity? Not necessarily. So there are two types of PCOS. There is lean PCOS and obese PCOS. So individuals with PCOS gain weight more easily due to the high levels of circulating insulin. Insulin causes a deposition of more fat in the body, because of which there is a higher tendency to gain weight in people with PCOS. There are other symptoms which occur due to the androgens, as I was telling you, what all androgens cause in symptoms. So there is hirsutism. Hirsutism is basically excessive sexual hair growth, which includes the face, the upper lip, chin, and the lower abdomen. There is increased production of androgens, which is the male sex hormones, and also decreased sex hormone binding globulin. It's a protein which binds with this androgens and helps in its excretion. But there is decreased production of that in PCOS, which is highly responsible for the androgenic features seen here. The other skin conditions that can be seen in PCOS is acne. Seborrhea is excessive secretion from the skin glands. There can be balding, which can be seen. There is a condition known as hidradenitis suppurativa. It's basically infection of the sweat glands. And then there is something called acanthosis nigricans, which is this picture. I'm sure many of you have seen it. It's very common. There is deposition of a pigment called keratin and increased thickness of the skin in these areas. This is due to high levels of circulating insulin. So this is very common with PCOS. So these are the signs and symptoms you should be looking for in a girl having complaints, and so that diagnosis of PCOS can be earlier. So if you think about it, it does not affect your life just physically. There's a lot, it takes a big toll on the mental health also. So there can be mood changes due to high levels of circulating androgens, there, which may lead to difficulty in concentration in school, which might take a toll on the academic performance. There can be weight gain, acne, skin changes. These all result in low self-confidence and self-doubt. Irregular menses cause a lot of anxiety and stress. So it makes you aware of the fact that you need to act on it sooner, so that, and acting on it doesn't mean taking a treatment as such, but there are some lifestyle modifications that you need to do. So before going to the coping part of it, we can so what happens in the reproductive age group and the postmenopausal age group, usually it is with this that people come to you, infertility or subfertility, which is a major issue in the reproductive age group. So PCOS, which has been ignored in the adolescents, can lead to infertility later in adults. It is basically the absence of ovulation which occurs, which is primarily responsible for this. And also there is an evidence that women with PCOS have higher chances of pregnancy loss also. And in postmenopausal women, the 40 to 60 years of age group, they have many metabolic complications. Like later in life, you will have diabetes, you might have diabetes, cardiovascular diseases, there could be hypertension, there will be endometrial carcinoma. So acting on it sooner and at the adolescent stage is even more so important. So how do we diagnose? So the first thing we do is we look for signs and symptoms, as we discussed with the clinical features. So that's one thing. And then we need to ask ourselves this question. So are there multiple cysts in the ovary? Are there features of increased androgen like acne, facial hair, seborrhea? Is there increased hyperinsulinism? How do you know that that can be with the clinical features or by the blood test? Or is there any other hormonal disturbance? So we need to ask ourselves these questions. And in the process of asking all this, there was a criteria that was formed, which is known as the Rotterdam's criteria, which was formed in May 2003. So there are three features. There is anovulation, there is no ovulation, there is hyperandrogenism, increased circulating male hormones, there is polycystic ovaries. So any two of these three should be present for the diagnosis. The drawback here was this criteria did not include insulin resistance in this. So other ways of diagnosing is there is ultrasonography. Ultrasonography basically gives you a chain of pearls appearance. This is called a chain of pearls appearance. There should be at least 10 or more follicles. There is increase in the ovarian volume as such. Then there are many hormonal studies. I won't go into the details of it. As you can see, there could be increased free testosterone, increased androstenedione. These are all androgens, DHEAS, DHEA. This all gives you the androgen, excess androgen in the body. There can be increased LH, normal FSH. So LH, again, luteinizing hormone, as we just saw some time back. There is a increased persistent LH. So that could be there. There could be increased estradiol or estrone, increased fasting insulin, increased insulin resistance. So all these are blood tests which help you diagnose PCOS. So then there is laparoscopy. As everyone knows nowadays, laparoscopy has become a mode of treatment and also a mode of diagnosis. So what is seen in laparoscopy, basically an instrument is put inside your abdomen with a camera in which you can see enlarged ovaries, and the capsule of the ovary becomes very thickened, and it gives you an oyster egg shape and color. So laparoscopy also serves as a way of diagnosis. So now we come to coping with it. So what needs to be done? So the first thing that has to be kept in mind is what is most important is perseverance. You have to be totally dedicated to it. It's you who has to take care of yourself to come out of it. It needs a lot of work. It's not easy. Getting disappointed with time is okay, but you need to get up back again and start doing all the things that you're doing for it. So we'll tell you what is to be done. So lifestyle modifications are needed. You need to do a little bit of weight loss and exercise, balanced and healthy diet, sleep. So these are the things that we can do. Then there are drugs like cyclical progestin, combined OC pills. I won't go into the details of the drug management. Ovarian drilling was a surgical thing that was done long back, but because of the side effects, it's a little bit less popular now. There are many natural compounds as remedies. We'll come to that also. So starting with something that we can do as the first, it's the hormone regulating habits. Habits you need to change. You don't need to take any drugs from outside. You just need to do a few things that will regulate your hormones in itself. So sleep is very important. You need to sleep for at least 8 hours or more. Try to be in bed by 11 o'clock at least. Have a good sleep, a dark, cool room. Maybe use some lavender oil on the pillow. A cup of chamomile tea can help sometimes at bedtime. You need to have a good, calm, good sleep. And also something that has become such a habit nowadays is being on the phone before sleeping, just falling asleep to WhatsApp or on Instagram. And that has actually, it has been seen that it disturbs your sleep cycle. So what you should do is at least 2 to 3 hours before going to bed, keep your phone away. There should be no screen time, no TV or phone before going to bed. Avoid caffeine. Many people wouldn't have coffee before bed, but if someone has that habit, it's better to avoid caffeine and sugars 2 to 3 hours before bedtime. And also exercise is important. I'm not saying rigorous exercise. Something which people have seen, which helps them is if there is weight gain during this part. So just 30 minutes of brisk walking after meals is something that helps a lot. Like if someone wants to exercise more, that's well and good, but at least minimum 30 minutes per day is something that is very much beneficial. So what are the dietary changes you need to take care of? So you need a protein-rich diet, fiber-rich diet, switch to healthier carbs, avoiding processed sugars, avoid refined flour. Dairy intake should be limited. It has to be at least less than half a liter a day. But something I need to tell you with dietary changes here is do not go for crash diets. Crash diets like keto, going for there is a all protein diet, or going for like liquid diets. All this might help you lose a lot of weight in a very short duration of time, but that is not good for your body as such. You need your body to understand that you are in a process of making a few changes. It need not be so drastic and so sudden. Also, for a normal menstruation to occur, body needs at least 17.5% of fat at any point. So suddenly reducing so much fat might just stop menstruation. So you have to have a steady, persistent plan in which you are making dietary changes, also a little bit of exercise, so that you're losing maybe not more than 2 to 3 kilos per month. It has to be a slow and sustained process, more than a sudden and drastic process. So moving further ahead, there are some natural compounds. So there are no studies as such saying that these compounds actually, there is no proven study as such, but then some people have benefited from this. So flax seeds, cinnamon, ground cinnamon, you can either have it with milk or with hot water. This has been seen to make some difference. Licorice root, green tea, spearmint tea, fish oil, all this is like it's just a hypothesis that some people have been benefited by all this. So what are the foods to avoid in PCOS? The simple mantra is have natural food, avoid processed food. So as the saying goes, eat foods which resemble how they look in nature. Nature does not put food in packets. So here is a list of things that should be avoided. So sugars, including some so-called natural sugars like candy, soda, juice, jams, honey, desserts, dried fruit, which many a times we think that it's healthy, but it has a lot of sugar in it. Jams and spread. So breakfast cereals, which you think mostly is so healthy, but it has a lot of sugar in it too. Then high GI carbohydrates like pastas, bread, baked products, pastries, white rice, white potatoes, gluten products like soy sauces, marinades, breadings and coating mixes. There's a lot of pastas, breads, all these things are very high in gluten. Dairy needs to be limited. I'm not saying totally avoid it, but try to limit it. Many of you have a habit of having cottage cheese, which is good, but then it has to be limited. It should not be, excess of what, it should be at least less than 500 liter a day. Then soy products like tofu, canola oil, grapeseed oil, soy milk, peanut oil can be had in less proportions. Processed meat, of course, should be avoided all in all. But then you would think that there is nothing for for people with PCOS to eat. It's not so. So there are some PCOS friendly snacks. There is guacamole. There are flaxseed. There is flaxseed crackers, veggie sticks. You can have hummus and veggie sticks, which is a very good combination, I feel. Berries, sunflower seeds, dark chocolate is something you can have. Almonds, walnuts, coconut yogurt. So you have a lot of options to basically. Indian diet as such is in itself a balanced diet. So having 2 chapatis, fiber-rich vegetable, a good protein-rich dal is good enough for like a normal person having this. So instead of going for keto or something very difficult in which you don't find the ingredients in the market itself, rather just go back to the normal ghar ka khana that people have. So that is there. And then I would actually want to conclude with this. So the main thing here is taking care of yourself. And as Emmy Medling says, a diva knows that taking extreme care of yourself is not selfish, but a vital part of the healing process. Thank you so much. And I think we can proceed with the Q&A session now.
All right. So thank you so much, Ananya, for this wonderful talk on PCOS. I'm sure many people would benefit from the basic changes that we can make in the lifestyle, and we can definitely help ourselves and prevent PCOS from happening. And even if we have it, we definitely can control it. So do we have any questions? If you have any questions, you can type in the chat box, you can ask, or you can raise a hand, anybody. All right. Okay, so I can see a question popping up. The biggest concern for anybody experiencing PCOS is infertility. So how exactly PCOS affects fertility, and I would want you to tell that is it impossible or is it possible for women with PCOS to get pregnant?
It's not impossible. It's see the thing with PCOS is it's a change which has occurred in your body. So for that, you would actually first want to know why it happens. Why is there infertility? And so if you remember, so there was a part where there is no ovulation occurring because of the change in the hormones. The hormonal imbalance causes no ovulation. Ovulation is something that is essential for conceiving, right? The ovulation is where the egg comes out of the ovary and then it gets fertilized by the sperm. So for that ovulation to occur, there is the hormonal mechanism that has to be there intact. So the entire change occurs because of the changes in the body, like the excess weight gain, the bad lifestyle. So that results in anovulation. So it's not something that is full and final. It's something that can be reverted back to normal. With these changes, we see many people who come to us with complaints of infertility. So we do advise them before drugs. The first thing we advise them is this lifestyle modifications, at least a trial for a few months. We ask them if they have gained a lot of weight in the last few months. Has there been a sudden change in their lifestyle with stress, maybe, or some event occurring in the family which has made them change the sleep habits, changing, eating at irregular hours. So first we ask them to revert it back to as normal as possible. If that doesn't help, then we go for drugs, which as I was saying, there are some drugs, I didn't go into the details of it, but ovulation inducing drugs. There are drugs which will push the follicles which are developing to ovulate. So there are many. It's not compulsory that a patient, that a person with PCOS can't conceive. It's difficult, but then it's something that can be reverted back to normal.
All right. Okay. So somebody asked, my friend has PCOD. How do I comfort her? I mean, how can I help her?
Okay. So see, the main it depends on which age group you're talking about. If it's adolescent, if she will mainly be worried about the skin changes or the menstrual irregularities. There will be a lot of dysmenorrhea, which is pain during menses. So depending on the complaints, if she is an adolescent, you can comfort her by telling her that this is not something that is permanent. You can work towards it. You can be there for her. Emotionally be there for her when she is having those mood swings of hers. You can be there for her when she is having feeling low about herself because of acne or because of any of the changes in her body. If it's someone who is in the reproductive age group who's having issues with conceiving, that needs a lot of mental support. You can be there for her by giving her options of what she should do and what she should not do, things she should, like foods she should have, the habits she should inculcate. So the main thing is being perseverant and not giving it up at once, thinking that no, I can't do it, I'm just gonna be like this forever. That the main thing is working on yourself. You need to be very persistent, and you need to be very strict with yourself also at times, controlling what you can eat, cannot eat. It's not easy for us at this. I know everyone has a habit of being on the phone, sleeping late. It has become a way of life now. It's not very easy to suddenly say, no, tomorrow you need to sleep at 10 o'clock, get up at this time, eat at the right time, because everyone has different work hours. But you have to take that extra step and you have to work a little bit extra on yourself. And in this situation, the person needs a lot of motivation. So Absolutely. You can be there for your friend for this.
All right. So the second question is, should cow milk be avoided in PCOS?
See, as I said, not necessarily avoided, but limited. You need not have more than half a liter a day. You don't need that much of dairy per day. In tea and everything, we as Indians, we are used to having so much of tea. Right. So you will have that much, but just limit your amount. You don't need to completely avoid it.
Okay. So the next question is there any problem to have periods every month, but few days earlier?
Like every month, few days earlier, or just once in a while? No, that's okay. That's how your cycle is. Everyone has a different length of cycle. Many people I know, like the normal cycle length is 28 plus minus 2 days, as many people know. But some people have longer cycles. Some people have 30 days cycle. So it comes, few days later. but every month, and some people have shorter cycles.
Yeah, if it is coming 3 or 4 days prior, is it fine?
That is fine. That's totally
Do we
fine.
consider it a regular cycle?
Yeah, it will be a regular cycle.
Okay.
It's just
If
the cycle length is short. Like instead of 28 days, the events occur in 24 days. Maybe that's why it's coming four days before.
okay, there is one thing mentioned. It's only when I'm on OCP my cycle is regulated. Else, it's not so. Her age is 17. What is OCP?
OC pills are oral contraceptive pills. The name is contraceptive because they were first used for contraception. Contraception is avoiding conception.
Right.
But these are basically hormonal combinations, right? So they have estrogen and progesterone, and some have only progesterone. So these are, so after, as we talked about it, after trying the lifestyle modifications, if sometimes that doesn't work, we go for drugs. So OC pills usually regulate your hormonal balance. So you need estrogen and progesterone from outside to regulate your normal cycle. That is common and seen with many people. It doesn't have long-term side effects. It's usually what we do is we give it for 3 months at a time. And usually in 3 months or so, it comes back to normal. If not, sometimes it's given for longer times. But the main thing is with it basically needs a lot of work on yourself. Sometimes maybe just the drugs alone might not help. You might need to have drugs and a little bit of change in the habits. The main misconception that stays is with PCOS, the only thing you need to do is lose weight. That's not it. You need to, sleep is so important. Sleep is the most important thing to regulate your hormonal balance. So no one emphasizes on sleeping in time. No one emphasizes on a good sleep. It's more like, eat less, don't eat this, go for this diet. So that is again there. Yeah.
Right. Okay. So the question is, my friend is suffering from PCOS, but her doctor has asked her to lose 10 kgs in 1 month. So, Ananya, nobody better than you can actually address to this question. Please throw light.
See, I'll say this, that losing too much weight suddenly is not good. I can say this from kind of a personal experience that suddenly losing a lot of weight does cause a lot of change in your menstrual cycle. There are people who have come to me in the hospital. You'll find patients who will come. They'll say, "Okay, but yeah, I lost like 15 kilos in a month, but I'm still not getting my menses." So this is because sudden drastic weight loss will not help you with. And what happens is when you have such a bigger target, it's difficult for you to do it also. You have a smaller target, it's easy for you to do. Like you keep at least a target of 2 to 3 kgs weight loss a month. It's something that is attainable. Targeting 10 and not being able to do it and feeling dejected and giving it up is, I'd say it's better to keep a smaller goal. The thing is, it has to stay. It's not like you lose 10 kgs today and then later you're like, okay, now my cycles are fine, I'll just go back to my old habits. You can't do that. It has to stay lifelong. So you need to make smaller changes.
Okay, so the other question is, I have acne and irregular periods and I'm gaining weight. Do I have PCOS? What to do?
So yeah, you might, I would not say you might be with irregular menses and acne and the weight gain. I'd suggest you go for a few tests. Ultrasonography is one. A few blood tests, as I said it before, you need to see your thyroid, one thing, because that is something, even without PCOS, that is something that can cause a lot of irregular hormonal imbalance as such. And then go for a LH levels, the luteinizing hormones, FSH levels, on the second day of menses. Also prolactin. So once you get all the best thing would be you go to the nearest person to you, they'll prescribe. I don't think you can get all this tests done just like that in a lab. You need a prescription for it. They'll give you a proper workup for PCOS. And I think once you're sure about the diagnosis, then you can go. But yeah, why not start the lifestyle changes from now on, even without a diagnosis? It's not gonna harm anyone. Yeah, these are just good changes. You can start doing it now.
Prevent it from happening if we are cautious from a very young age.
Yeah, definitely. Like you don't need see, if you're gaining weight, if you're getting irregular menses, just changing your habits is not going to harm this in any way. Maybe just before the diagnosis you can start it anyways.
Okay, so the other question is, as due to high production of androgens, one gets weight gained up and gets acne. The question doubt arises is, are the same ones perpetual?
Are the, sorry?
Same ones perpetual. I didn't really get the question properly. I'll just repeat it again. As due to high production of androgens, one gets weight gained up and gets acne. question or doubt arises, are the same ones perpetual? I think they are trying to ask that, is it
constant?
Yeah, maybe.
No, it's something that is reversible. Again, the high level of androgens is because of the insulin resistance, which is because of the increased body fat or because of the wrong habits that we have. So it's something that is, so that's what I've been saying. PCOS is not constant, it's reversible, but you need to keep working on it. It's not like fever, cold, and cough that with medicines it'll go away and not come back. It's something you need to keep working on. It's like a parallel process that has to keep happening.
Okay. So the other question is, I experience pre-period pains. What can I do? Why does it happen? The student is 17 years old.
Okay, pre-period pains are kind of like you're talking about dysmenorrhea, which is normal, can be normal, and if it's too severe, it needs to be worked on also. There are different conditions which can be causing it. We need to know how severe it is. Start with a hot water bag for hot fermentation. You can start with some pelvic exercises which increases the blood circulation in the pelvic area. For that, you can just Google yoga for yoga for the pelvis. So this might help in the beginning. But if it does increase and if it's too severe, I would suggest you visit someone close by, someone who can examine you before making a comment on it.
Okay. Somebody has asked this question. I had spotting and not proper periods recently, and I'm not feeling pregnant. Do I need to see a doctor?
Yes, you do. If you have had any intermenstrual bleeding, that is spotting between periods, like not in time of your periods, or something that is different from your normal cycle, be it like even if you're pregnant, even if you're not, either way, I think you should see your doctor, get yourself checked once so that you know for sure if it's normal or not.
All right. Is it related to PCOS that before periods we have acne and then after periods it just cured itself?
And no, the temporary acne is not because of that. As if you remember, there was a diagram with the hormonal changes throughout menstruation. So there is a time when there is increased estrogen and increased progesterone just before the period. So that causes the acne, but that is nothing to be worried about.
It is the fluctuation in the hormones that is basically.
Yeah.
Okay. Losing and gaining weight frequently, is it a problem? That means gaining weight fast and losing it fast too. So yes, then again, it's fluctuation in your weight. Is it a problem? That is what the person wants to know.
Yeah, I kind of didn't get it. Like,
okay, she is asking that if we gain weight suddenly and if we lose weight suddenly, is it a problem? Does it affect our cycles or our overall health?
It does actually. Gaining suddenly is, of course, it's bad. Like, you should not gain a lot of weight in a short duration. Also, staying between in your BMI range. BMI is basically your body mass index rate. Yeah. So I don't actually know if you're saying of sudden weight gain in a person who was really skinny to a normal weight or someone who was normal to going into obese. So we don't know which one it is. But so yeah, it is kind of problematic. Like, you should have a steady state in all times, I'd say.
All right, because I can understand that most of the questions are coming from students because but still there is some things, some concepts remain unclear to them, and with time only they'll understand. And since they are in their phase of ups and downs in terms of their hormones, they definitely must be experiencing some things. And it's wonderful, that they could actually come up with their questions, because there are many questions that nobody has answers to. And I know it from my experience that when I was about 14 or 15 years old or 16, I was so hesitant to even talk about
it. Yeah.
It was not easy to go and buy a sanitary napkin for myself.
Yes.
I can totally understand that it's not easy. And since we could have this session, I'm sure many students have put out their doubts. And Ananya, in future also, I would like to communicate with you on a public platform.
Definitely.
We can definitely connect with more students, so this movement becomes bigger and more lives are changed, and we have more, we have lesser people encountering PCOS in future. So Ananya, I think we are done with the questions. I'll just have a look in the chat box once more. Okay, so we are done with the questions. I would like to invite Ms. Rimpi Saraugi, who is the co-chair of Thaler, to extend her thanks on behalf of YI and Kota. So Mohit, please take Rimpi in the spotlight. Yeah.
Good evening, everyone. I would say a highly educative session. Thank you, Dr. Ananya Bora, for enlightening us with your knowledge. It gave us deep insights into the topic and also revealed some interesting facts. The point where Dr. Ananya told us about how PCOS presents itself in adolescence can be really helpful for students and parents to act it sooner. I completely agree. Like, as right now, even Mrs. Smithika Singh said that students right now, they have a lot of questions about it. But yeah, if we get to know about it in an early stage, it can be really helpful for them to act it on it sooner. Yeah, also, as Mrs. Smithika Singh said, we could not imagine discussing about PCOS or PCOD in public. Forget about PCOS. Females were ashamed to discuss their cycles in public. So on that note, I would like to thank her for inviting Dr. Ananya Bora to educate on this. Thank you, Mrs. Smithika Singh. I would also like to thank all the participants for joining us, especially the teachers and students at this hour. Last, I would like to express our gratitude to Modern School for letting us use their virtual platform, without which this interesting seminar would have been impossible. I would like to end on that note that the only thing more shocking than the prevalence of PCOS amongst women of childbearing age may be the lack of awareness surrounding it. So talk about it and educate your surroundings. Thank you.
Thank you, Rimpi. And once again, very, very big thank you, Ananya. And thank you, Zanita, as well, because she's the one who connected us. I think
Yes.
So it was wonderful to have you, Ananya. And I look forward to having you online more often. And I hope many people benefit from it. Thank you so much.
Thank you. Thank you so much.